Om Namaste and good morning to everybody. My name is Mani Mistry and I'm taking the class today. Today is Monday.
Mani, I'm just going to put that in the Facebook as well, if you don't mind. Just give me a second.
Start again.
It's not going in the Facebook yet now. I need the password. Sorry.
Okay.
Give me a second. So many passwords I've lost also. Okay, just start. It wouldn't go on the Facebook just now. Just start. That's it. Okay, only go. Thank you.
Okay, we start again. So it's Om and Namaste and good morning to everybody. My name is Mani Mistry and I'm going to take the class today. And I welcome you all to Yoga with Sam. Today is Monday, the 23rd of January. And the color of the day is white and it's freezing outside. It's a lovely dry day, but it's really, really cold. Everybody is freezing today. So we will start with Om, then we'll start with jogging. We're just going to warm up first, and then we do the pranayama. So we sit comfortably, whichever, either you're sitting on the floor or sitting on the chair. So we sit on just sit in the Gyan Mudra and place it on your knee and back straight. And we will chant Om 3 times. So by chanting Om, we're going to wake up our chakras. And also it will stimulate your vagus nerves, activate your vagus nerves, and stimulate your parasympathetic system. And that will help you to relax, calm you down, and prepare you for the pranayama. So we will chant Om 3 times. Take a deep breath. Keeping our eyes closed, rub our hands, warm up. And then your hands gather energies in your hand. You pass it on to our face, or cup it and put it over your eyes. Just transfer all that energy to your eyes. Good for the eyes as well. And then slowly open your eyes, and then you can just massage it around your eyes. Over your eyes, over your eyebrows, your forehead, your face, and then just do your V-shaped finger, and then between your ears, and then on your neck, go at the back, and then all around the body. First, I'll start with the nitric oxide, as we are coming into the winter. And a lot of people are suffering from cold and also catching COVID-19 as well. So we will do the nitric oxide exercise. So nitric oxide is a colorless gas. It comes into a tiny bubbles when they burst open. It dilates our blood vessels and expand our lungs. And they're very, very short span, so you got to make lots of those bubbles. So when the bubble blows up, we call it vasodilator. So it relaxes your blood vessels, dilate your blood vessels, so the blood can flow easily because the blood is sticky. is thicker than the water. So you just need a good slow flow, a freely flow, sorry. So if you've got a high blood pressure, it will help you to lower the blood pressure and also prevent the heart problems, any heart condition, heart attack. So you've got to make sure that we keep our arteries open and keep our lungs expand as well, so the oxygen get in, so the oxygen will mix with the blood and it will circulate around the body. It's also fight infections. It'll kill bacterial infection, viral infection, fungus infection as well, and keep our lungs healthy. So we need to do this exercise frequently and also eat the right diet. So you make sure that you eat lots of green leafy vegetables, things like celery, spinach, beetroot, small amount of dark chocolate, and make sure that you chew your food properly and mix it with saliva. It mixes it with saliva and with good bacteria, and then it goes down to your stomach, mix it with the rest of the acid and rest of the juice, and become nitric, and then become nitric oxide, and that will circulate around the body. It mixes with the blood and goes around the body. Make sure that you do not use any chemical mouthwash because that will destroy your bacteria, good bacteria. Make sure that you do salt gargles if you don't suffer from any high blood pressure or heart problem. Do any other like oil and lemon or whatever you find Ayurvedic mouthwashes. Just stay safe. And then we do humming. So when we do humming, we will produce a lot of nitric oxide around our nasal passage. So we got to make sure that we keep our nasal passage always clean and clear, and make sure that you clean frequently when you go outside. When you come back, you got to make sure that you keep your nasal passage clear, and always breathe through your nose. And if you have to, you can breathe out through your mouth. But it's breathing in and out. Nasal breathing is more important because you need to keep your nasal passage clean. And that's how you keep our lungs healthy. So we will do humming. Humming will produce a lot of nitric oxide. So what we'll do, we will just by putting our hands over the ears, and then you bite your teeth, and then you put the tongue against your teeth and you make humming sound. You can do with the, 5 times or 10 times, whichever you find. But if you feel dizzy in between doing humming, please stop and then you start again. And then afterward, we'll do the blowout exercise that will help to circulate your nitric oxide that you have produced around your body and feed all your muscles as well. So we will do the humming. So close your ears. And then bite your teeth, put the tongue against your teeth, and take a deep breath. Relax, and we'll stand up. Whenever you're ready, we will start the nitric oxide exercise. So before we start, everybody getting ready, just health and safety warning. Always take medical advice when you're doing any physical exercise or any yoga session as well for any other reason. that you can't do it, please do not do it, and do not force yourself to do anything. When you do it slowly, you don't have to do fast. Whatever you are capable of doing, please do it. And if you do get tired, take a deep breath and then blow out through your mouth and take a rest in between. I'm going to do 20 times, but you can do it whatever numbers is suitable for you. So we will start with 1. To the wall. Next, starter. Next. And then we do the just beach ball. Next. Take a deep breath. And blow out your mouth. Do one more time. Then we do jogging. Should be doing 3 times. But if you do this exercise 3 times a day, if you have got cold or you got COVID. Starter. Last one. And relax. Take a deep breath. Go to jogging now. Again. Let's do whatever you can. There's a lot of bending down, a lot of physical strength you need. When we do this, jogging, make sure that we feed all parts of our joints and also get all the energy for the rest of the day. By doing all this exercise, you are taking in a lot of oxygen, as well as you're raising your heart rate, so they make sure the blood is circulating well. So start jogging. Don't forget to breathe in and out. You always breathe in when you go up. When you come down, you breathe out. Just stand there and do it. You can jump, it's be good. And relax. We put our hands on the hips. With this, if you find comfortable, you go to make sure your hand stays on the top, and you bring your knee up. And then we clap. And then we do the opposite hand. So opposite elbow and opposite knee. And relax. Next, we're going to sit like you're sitting on a chair. So you can first we do this way. So come down as far as you can. Just hold there. And you come up. Again. One more time. What we do is relax. We do the knee. So make sure, put your hand on the knee and support it. Breathe in and go 1, 2, 3, 4, and 5. We do reverse. 5, 4, 3, 2, 1. Then we do legs apart. Bring your knees in. 1, 2, 3, 4, and 5. We do reverse. So bring your knees out, then you bring it in. 5, 4, 3, 2, and 1. And relax. Next, bring your legs apart. You can do stretches now, so be careful, do whatever you can. Hand in the front, breathe in, and you bend your one leg, right or left, whichever. And you come up, then breathe again on the left, and breathe out. Carry on. Do the last one. And relax. And bring the legs a little bit in. Then with your hand, support the knee. Then you bend the right leg or left leg, whichever, and make sure that the leg is straight. And look up, expand your chest. Hold the breath if you can. Then breathe out, go on this side. So carry on. Left. One more. Next, we put the hand on our waistline and you do the same thing. Get your balance. Do it slowly. Next, we will do the namaste on the top. And then we do the same thing. Come down. You can put your knee on the floor if you can. And breathe out and do the other side. Last one. And relax. Next, we're going to expand our lungs. So you breathe in, and then you open up your arm as you breathe in. When you come down, you breathe out. Do 10 times. Last one. Relax. Right. Legs inside a little bit. Raise your right hand or left hand and straight. And then come down one side as far as you can. Just hold it there if you can hold the breath. Then you breathe out and do the other side. Do a bit faster if you can. Last one. And relax. And then we're going to try to take the breath and we're going to touch the opposite toes. As you touch the opposite toe, you look back. So you breathe in, go down, look back, breathe down, go the other side. Last one. And relax. Now the next one, we're going to bend back. So be careful if you've got hernia or acid reflux, just do not do it. And if you've got back pain, don't bend forward too much. So you breathe in, and breathe out, and go as far as you can, and go touch your knees, touch your calf muscles or your feet. Last one. And relax. Next, we're going to do the star jump. 1, 3, 1, 3, 1, 2, 3, 1, 2, 3. Now we do the jump. 1, 2, 3. Only if you are able to do it. 3, 1, 2, 3. Right, I'm going to do the faster 10 times. If you can do it, otherwise you don't have to do it. Now we start. And relax. You can do 20 times as well. I can just do it 10 times this time. Now we're going to do a Tadasana. Now Tadasana is very good to improve or you maintain your height and you improve the height in the children. So we encourage the children to do this exercise. And then also is help you to for your digestion and good for the constipation. So you can do this exercise when you get up in the morning. So we interlock your finger, put the hand on your head, and then you take a deep breath, twist your hand, and then it goes up, and you stand on your toes. You stand there for a little while, and you come down, and you breathe out. You do it again. One more time. Your legs slightly apart. You're going to do a twist. So again, twist your hand, breathe in, and then you go one side. Make sure your hands are straight. Do that. The other side. This one. Stretching your side muscles as well, and also good for you, expanding your lungs as well. So now we're going to do the twist. So we're going to go back. So hands in the front, take a deep breath and go back. Hold the breath if you can. Then breathe out, come from the front, go other side. All this helps to exercise your internal organ, your digestive system when you get up, and help you to move your bowels without any problem. The next one, you put your right hand on the left shoulder, the left hand behind, and you twist, breathe in, hold the breath if you can, breathe out, and come on the other side. Last one. And relax. Next one is that we're going to do a dance, jigger dance. Good for the waistline, good for the stomach. Again, good for the digestive system as well. And your hips. So, upper part of your legs as well, your thigh. Carry on doing it. And then we do reverse. 6, 7, 8, 9, and 10. And relax. Now we do the yogi twist. Yeah. So hand in the front, and your legs goes up, your feet goes opposite, and your hand goes opposite. And then you breathe in and out. You jump, or you just stand there and do it. And relax. Take a deep breath. And breathe out. Again. Hope you feel better. You got lots of oxygen now. Your heart rate is beating fast. So you feel good, feel energetic. Then we're going to do Surya Namaskar. So before we do Surya Namaskar, we can just do some clapping. Surya Namaskar is a saluting the sun. And you will see lots of hormones. You have a way. Clapping, we are activating all our organs as well. Right, so whenever you're ready, you can stand on your end of your mat. We'll do 2 of these and 2 in the chair. Right. So we do pranayam first. So we put our hands together. You breathe in. As you breathe in, you twist your arm, and then you breathe in, and then you raise your hands and you go bend backward as far as you can. If you can't do it, don't worry, don't hurt yourself. Then you breathe out, bring your hands beside your feet, or as far as you can. So you breathe in again, take the right leg back, and you are looking up, resting your chest on the left knee. Then go forward, bring the left leg back, and you come into a mountain position, Parvatasana. So this is number 5. And then you breathe again, bring your knees down, make sure your buttock is up. And you breathe out as you bring your chest and the chin on the floor. And then you slide up, or you can lie down if you want. Then you breathe in again, and you come into a Bhujasana. That's number 7. Then you breathe out again, back into a mountain position. That's number 8. Number 9, bring the right leg forward again, looking up. Number 10, bring the left leg forward. So number 9 and number 10 both fit together, and you're bending down. And then breathe again. Number 11, come up, raise your hand, bend backward. And then number 12, back to pranayama. Right, so we do the numbers. So 1, we do with the left leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Right, we do the right leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. With the left leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Now we do the chair. We'll make sure you're sitting in a chair, make sure you're comfortable. And even you're able to do it on the floor, you can always learn how to do it on the chair as well, because you might find somebody who wants to do this Surya Namaskar on the chair, so you can teach them how to do it. So it'd be nice if everybody could do it on the chair as well. So we will do it. Make sure you're comfortable, come a little bit forward. And then we do the numbers. We do 1, 2, 3, come down. Either you put your hand in the front or either side. Then you bring the right leg up. 3, 4, 5. Then go 6, 7, 8, 9, 10, 11, and 12. We do with the left leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. We start again with the right leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. We do the left leg now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. And relax. Take a seat now. Down. Let's do the Vasika, and we will do some lung exercise. So be comfortable. And Gyan Mudra. back straight, just for 30 seconds. To do Bhastika. 2.5 seconds to breathe in, 2.5 seconds to breathe out. When you breathe in, bring your stomach out, breathe out, it relaxes it. Your stomach goes in. We're going to do some lung exercise, so some breathing, and we're doing Kapalabhati as well. So the health and safety warning for Kapalabhati, always do it on an empty stomach. If you have breakfast, you wait 2 to 3 hours, because it's a forceful breathing out, and you're breathing at the same time, so you're moving your abdomen. So you're doing, so it's can be very painful for people who had a breakfast, and people who cannot do it. And people who had a surgery within 6 months, please do not do it. And anybody's pregnant, it's not for pregnancy, or anybody who's trying to get pregnant or going through the monthly cycle, please do not do it. If you've got a high blood pressure, and if you've got any other heart problems, please do not do it. If you can't do it, you can just do Bhastika, or you can do it slowly. It's 1 second, 1 stroke, 1 second, so you're doing 60. But you can do it. If you can't do it, just do it 30. So do it slowly. And because it's also exercise your internal organs and expanding your lungs, you're strengthening your lungs as well. Look at Kapalabhati is excellent. He's the master of the pranayama. That's what Baba Ramdev says. So we will do Chin Mudra first. Upside down. Chin Mudra is upside down. And this helps to expand our bottom part of our lungs. So we do Bhastika for 30 seconds. We do same mudra, we do Kapalabhati. And relax. Next is Adi Mudra. So you thumb in, then you make a fist and place it on your knees. And this will help to open up the upper part of the lungs. And it's the first mudra. So we do Bhastika. And this is the same mudra, we do Kapalabhati. and relax. Again, we're just going to expand our lungs, so we'll stretch if you want to. When you breathe in, open your arms, and you breathe out. You breathe in as you go up, and you breathe out as you come down. And the last one, and relax. And we're going to swing our arms, and that again squeezing out the toxin. So you put your hand in, and then you breathe in and out. And relax. Next, put the both elbows together. You go up, you breathe in, breathe out. And relax. The next one, we're going up. As you go up, you make a fist, you go up, open your arms, and when you come down, make a fist and come down, you breathe out. You do that 10 times. Last one, and relax. Feel good? Next, we could do for the people with the lungs and asthma as well. So we will just do some breathing. So we do breathe in, take a deep breath, and then you blow out. As you blow in the straw, just increase your lung capacity. So we do again. Yeah. Doing this exercise for people who got asthma is very good because it will increase your peak flow. So more you do it, longer you do it, longer you blow out, you increase your lung capacity. So next we were going to do the tapping on the thymus glands. Thymus glands, it's between your thyroid and your sternum. It's there, just up there. And then it produces tyrosine hormones that help you to produce lots of T cells, white cells, and that help you to fight infection. And also, this is for the anxiety. If you're anxious, you can always tap it. That will help you to release your anxiety. Or you can just press it gently and then do Kapalbhati. Relax. Next, we will do breathing in, and then we're going to do coughing exercise. The coughing exercise is going to help you to unblock your arteries and also prevent stroke or heart attack. So we take a deep breath. You can sit any mudra you like. Breathe out. This time we take a deep breath and then we cough. Do it again. And stay down. That helped you to release all the, loosen up your mucus or inflame on your chest. And do the last one as a dog pose. So sit like this or on the chair, whatever. And take a deep breath. Then you cough. And just stay down as long as you can. You can feel you're draining your mucus. We'll do it longer if you have chest infection. Next, we will do Vastika. Vastika is the first pranayama. So you sit in a Gyan Mudra. Again, make sure your fingers are straight. And Gyan Mudra help you to concentrate. Also help you to boost up your memory as well. Relaxes you. And also lowers your blood pressure. And also help you to meditate. And then you concentrate on your third eye. That will also help you to meditate. And we do with the Khetri Mudra. Khetri Mudra is you lift your tongue and touch the palate of your mouth, and that will help you to activate your vagus nerves, and then it stimulates your parasympathetic system. So all these three will help you to relax, calm you down, and help you meditation. So if you are tired any part of the day, you go anxieties, to Vastika. So we will do Vastika for a couple of minutes. So you just make sure back is straight and you're comfortable. And you're doing 2.5 seconds to breathe in and 2.5 seconds to breathe out. So when you can do it 2.5 seconds, or you can do 3, 4, whatever, you are able to do it, how your lungs are strong. So when you are breathing in, what you are doing, you are taking in oxygen. When you breathe out, you're getting rid of the carbon dioxide. So when you breathe in, you take in oxygen, blood will enter the lungs, take in oxygen, and will give out the toxin. And we get rid of it when we breathe out. And then the blood will go around the brain and the rest of the body. It will circulate pure oxygenated blood to your body, giving you lots of energy, feeding your cells, producing new cells, help you fight infection, increase your lung capacity, giving you clean lungs, giving you boost of your immunity as well. So you're able to fight infection, controls your body temperature, balances your hormones as well. And you're also doing your internal organ exercise at the same time. So there is lots of benefits just doing Vastika. Just raise our hands. Pass your energy on your face. We do some leg exercise now. Stretch our legs. So we just loosen up our muscles. Let's give it a good massage everywhere. Put some oil. First, when somebody is doing the massage, just tap it. Okay. Smile. On the stomach as well. We haven't didn't have a big breakfast. And then we line it with umbilical. We go at the back and we do our kidneys, adrenal glands. Make sure our kidneys are in a good condition as well and healthy. And then we just stretch. Let's do some knee press up. So make sure your knee, your heels are straight, your back is straight, your hand on your knee. Then you breathe in and you lift just put a pressure on your knee and then lift your knee up. Just so you feel your calf muscles as well. Stretch. And then down. Breathe again. Down. Again. And relax. There's lots of other exercises you can do it sitting down, but we just do some few ones. So we just wiggle our toes now. This exercise is for the arthritis and gout. Gout is, I hope everybody knows. I won't ask question this time, I'll ask a question next time. Gout is the building of uric acid in your kidney. And when your kidney can't get rid of it, it will go in your joints, cause a lot of inflammations, pain, and swelling as well. So by doing all this exercise, it will help you to get rid of your uric acid. So now you breathe in, bring your toes forward, you breathe out, then the toes goes back. So you do 10 times. And 10. And then both heels together, and then we rotate. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, 4. You just tap your heels. Very good. And then we do wipers. So we do try to touch your toes if you can. So we're doing this. And moving all your hips, the lower part of your legs, hips, your knee, your thigh, your calf muscles. And relax. We do that. You want to support your knee, or you can hold it like that, whichever you find comfortable. And we just lift up 5 times. You can do more in your own time. And then we do 1, 2, 3, 4, 5. Reverse. 5, 4, 3, 2, 1. And then 1, 2, 3, 4, 5. 5, 4, 3, 2, 1. And relax. So we do the other one. 1, 2, 3, 4, 5. Rotate. 1, 2, 3, 4, 5. High. 4, 3, 2, 1. High. 1, 2, 3, 4, 5. Reverse. 5, 4, 3, 2, 1. And relax. Next, we'll bring one leg over your thigh. If you can't do it, just put it beside. And then, I don't know, there's some noise that my next door neighbor, I don't know, making. Sorry about that if you can hear it. And then put it on your thigh. And then with the right hand, bring the right knee up, breathe in. And then come down. Press it down as far as you can. Again. And again, then now you rotate your ankle. Slowly, if you got arthritis, if you got a lot of swelling, do it gently. Then you reverse. And then we will do all the pressure points. We all know by now, all your sinuses on the top. And then we go the last, between the last 2 toes is your ear point, pressure point. And between your second and the third is your eye. And then your top of your toe is your brain. Then we got your neck, and then we got your thigh right there. And then we got come down, we got our lungs. Then you come down your middle part of our body, your digestive system, kidneys, spleen, no kidneys, sorry, not spleen, it's on the other side. And the lower part of your lung, your intestine. And then on the side is your spine. And again, you've got all the pressure points that you can just bring it down. You've got your meridian, liver meridian between the first and the second. So we put a pressure point on there. And then just give it a rub. And then you can just tap it, activate a bit more. And then we hug our baby. Then give it a laugh. Ha 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 ha. Ha 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 ha. Ha ha ha. And then bring it up if you can, right? And we do the same with the other one. So you breathe in. And now just stay a bit longer when you do it in your own time, so do it slowly. And then breathe out. Everything we do in a very short time, so we can't spend a lot of time. So we have to find, we try to find our time. We are very busy doing our lots of housework. So please try to find the time and do some exercise if you can, if you can't join the classes. And then again, do the pressure points. Even doing some breathing exercise will help you as well to build up your energy. And do all the pressure points. Then underneath your little finger is your heart pressure point. And then as you come down, in the middle is the spleen. And the pressure point and the side. And tap it. Sorry, I forgot doing the front, but you can do the front. And then hug the baby. Ha 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 ha. The hug. And relax and do the butterfly technique. Butterfly is, it releases the sciatic pain and also help you to pump up the lymph fluid and also reduce the fat around your thigh and in your stomach area. So when you're sitting, if you can do it, or if you're on the chair, you do it like this. So always showing you how to do it. So I'll carry on with this one. We do some hand exercise. I think we do along belong first, I think. Then we do some hand exercise and do some mudra. So we'll sit. But when we do along belong, we do the Vayu Mudra or you can Sunya Vayu Mudra, whichever you prefer. So left hand goes onto your left knee, and the right hand, you close your right nostril, press it down, press your right nostril, breathe through your left nostril, and then you will swap over, press the left nostril, then you breathe out from the right nostril, then breathe again from the right nostril, and then you breathe out from the left nostril. So on the right side is your sun, you take in the hot air, and the left side is the moon, you take in the cold air. So we're going to balance it. So make sure you're straight, back is straight, and then you always start with the right hand. If you get tired, you can always support it with the other hand, or then you can swap over to the left side. And when we finish, we'll breathe out from the left nostril. So we'll start. Breathe in, 2.5 seconds to breathe in, and 2.5 seconds to breathe out. You can do it longer, 3 seconds, 4 seconds. Same as Bhastrika. Make sure your room is well ventilated, with the fresh air when you're doing it. Anulom Vilom will help you to unblock your arteries, again, prevent the heart attack, any heart conditions, any heart problems you have. It helps you to cure a lot of disease, not just for the heart, but if you got diabetes, if you got high cholesterol level, you've got high blood pressure, you've got sinusitis, to increase your memory. There's more oxygen we take in, more healthier we become, because we need healthy cells. If you suffer from any condition, always start 5 minutes and then increase your time and go up to half an hour to 1 hour and do it frequently, 3 to 4 times a day. And it will help you to cure your disease as well as slow it down. You're able to reduce your medication. And the practices can be done anytime, before and after food as well. You breathe from the right nostril. Breathe out from the left nostril. Please take a long time, your own time. We will do the hands. Longer you do it is better for you. What do we do? This is also good for you. Arthritis, carpal tunnel syndromes. You've got bad arthritis, do it slowly. It can be very painful for people who've got bad arthritis, so do it slowly and do it frequently. The next is this. Also, you can do this. And then you put hands in together, then rotate. And then we do reverse. You keep your hands straight if you can. And then bring them both together. Just expand it a bit more. So breathe in. And then bring it forward. Hold it. Breathe out. Again. Find it hard sometimes, isn't it? And relax. Next we do good for the wrist. So if you get pain in your wrist, got swelling, do it again slowly. And then we turn and we tap it. and sideways. And then both elbows together and stretch it as far as you can. Do 5 times. Then we do reverse. Again. Go for the frozen shoulder as well. And turn your elbow. And relax. And then we do Ganesh Mudra, or you can just hold your wrist and we go up, straight, make sure you're looking straight, and then bend it, breathe out. Last one. And then interlock your finger and go at the back and just press it. Right. Hands against your head. Breathe in, hold it, press out. Again. Bring it on top. Good for the migraine as well. If you got a neck pain, we'll go on the side. Left. And then we done the front. Sorry. So we do the neck exercise now. So just breathe in, you look up, down, look up, down. Make sure you keep your eyes open. Down. And then you look at pendulum. Right, in the front. No. You can always support your neck if you got a lot of pain. You can always, if you get, again, if you can't do back up and down, you can always put your chin down and just rotate from left to right. Just swing it. Will help as well. Next, we will look straight and then breathe in and go right. Go back as far as you can. Breathe out from the front and go left. Relax. And then go left. Then you go up, right, down. Rotating. Left, up, right, down. Left, up, right, down. Now right, up, left, down. Right, up, left, down. Now make a big circle, left, go up, and relax. I'm going to do some Kapalabhati now, some mudras, where we're going to extend our spine. So again, Kapalabhati, please do not do it. If you're suffering from any heart conditions or had an operations, I've just already explained all the health and safety. So first of all, we will do the Namaste. Go straight our back. Make sure it's that you're looking straight. And we do Kapalabhati. We won't have enough time, so we try to do in a short time. So we do Sahaj Sang Mudra. So interlock your fingers and both the thumbs in there. And this is also correct your spine, and it's also for flexibility. And if you have slip disc. Do the Bhavadanta Mudra next. So thumbs up. This is also good for the back, and it stretches your spine from the top to bottom. Sorry, from bottom to top. So we do do upside down. We do it from top to bottom. You can do it with Bhastika as well. If you can't do Kapalabhati. Let me put the thumb outwards. So this is also good for the back pain as well. All these mudras. We do inwards. Relax. Do the eagle pose. So right hand, then goes left hand underneath and twist it. And then you look up straight and do Kapalabhati. Then we swap over, do the other side. Same again. All these help you to correct your spine and as well as massages your abdomen and your digestive system. So we're going to do Gomukhasana. So left hand, I've got my left leg up. So your left hand goes from the top at the back, then your right hand behind and try to touch, if you can, both hands together and do Kapalabhati. And we do the other side. If you can sit like this, you can. If you don't have to, and then see whatever you can. And the left hand from the bottom and look up. And relax. And we do Vakrasana. Again, it's good for the digestive system. So stretch your leg, bring the right leg. You can put it there if you can, or bring it over your knee, left knee, and then your right hand at the back, and your left hand, you push it, your knee, and then try to touch it, or you can hold it, and you look up, and you do Kapalabhati. What you do in this one is you're massaging the left side of your body. So you're massaging your spleen, your lungs, and your heart. And then on that, do the opposite now. So right leg straight, left leg over your right knee, left hand behind, right hand push the knee, and then hold, and you look up and do Kapalabhati. So we're massaging on the right side, your kidneys and your liver and your spleen and everything. Right side of your digestive system. And then next when we do Sank Mudra, that is help you to for your thyroid and also for digestive system. So hand and the thumb in the middle, close your fingers, bring the other fingers on the top, and then you touch your index finger and your thumb, and we do Kapalabhati. We do other one. So we can do one for digestive system and one for your thyroid. So left thumb, close your fingers, all together. Yeah. 10 relax. Next, we will do Udan Mudra. So Udan Mudra is all your fingers touching the thumb except the little finger. And we put it on the shoulder and we're going to twist. And this is also good for your thyroid. And if you got any speech problem, and also it increase your voice. So if people who are singers, it can be also good for you. And if you try to be a singer, do this mudra. And relax. We can practice this mudra before Wednesday, so we'll be able to sing nicely for Independence Day. Next, when we do Vayu Mudra. Vayu Mudra is Vayu-related problems. So if you got any joint problem, arthritis, and also any Vayu-related problems, so if you got any gas building up, so this is a good mudra. And relax. Before we do Prana Mudra, we'll do grinding. So we interlock our finger, make sure the leg is straight, and do the left thumb up. So we do the Vidyalinga Mudra. So you breathe in, you go back, you breathe out, and you go forward. So breathe in, and then do it 10 times. 4, 5, 6, 7, 8, 9, 10. Reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Last week week before we did a little bit different. We opened our part of our legs, and we can start from the left side. So we can do like this. Proper way of doing Chakti. We'll just do it 10 times, 5 times. This is better. Now we go reverse. You can feel it. Wait, straighten it. Proper way of grinding. Last one. And relax. Next, sorry, keep our legs apart. And then touching opposite toes. Breathe in and out. You all know. And relax. And do Makhan 20 times. Make sure back is straight. And relax. So help you to lose a lot of fat around your stomach and strengthen your legs as well. Next we do Prana Mudra. So Prana Mudra is a little finger and your ring finger. And Prana is the most powerful mudra. They help you to, it's a life energy, and help you to increase your immunity, and also good for your eyes. And relax. Do it longer when you're on time. Next one is Apna Mudra, Pan Mudra, and we're going to twist it and then exercise your internal organ at the same time, and it releases all the toxins from your kidney, from your lungs, from your stomach. and relax. Next one is Surya Mudra. Surya Mudra is a liver-related problem, and it's also good for the people who are diabetic, lower the cholesterol level as well. Next, we will do Apan Vayu Mudra. So your index finger and then the touching, pressing the thumb, and then other two fingers touching the thumb, the little finger up. And this is also people who's got a high blood pressure can do this, and people with a low blood pressure, they do Linga Mudra. And relax. Apana Vayu Mudra is also help you to, if you got any heart problems, and if you got high blood pressure, and also help you to climb the stairs. So other benefits as well as, lowering the blood pressure. And also with the Linga Mudra is also build up your heat. People with the asthma is also good for that. So we do Mandukasana, sorry, Varun Mudra. It's a little finger. That's good for the skin and for your if you're dehydrated. This is mudra. You need to do it. And relax. We do Mandukasana. Sit in the Vrajasana if you can, or you can sit in a chair, whichever comfortable, and it's to help you for your digestive system. People who has diabetes can do it half an hour before the meal, 3 times a day. So we're going to activate your liver, and it will help to release the insulin from your pancreas as well. So you make a fist, take a deep breath, you breathe out, then you put it between your belly button, then you come down slowly. So take a deep breath, belly button, press it down, come down slowly as far as you can, and you look up. If you can't hold the breath, you can do it, or you do Kapalabhati. If you can't, just stay like this. And breathe in and out and come up. We do one more time. Breathe in, breathe out. Press it down, come down, look up. In and out and come up. And we do it this side. On your liver and your spleen. On the left side, and the right side is the liver and the pancreas. So breathe in, breathe out, press it, and come down. In and out and come up. I'm only doing once, we'll do it more next time. People who can't bend down, the right hand over the liver and the pancreas, and the left on the spleen. Take a deep breath, press down, and relax. And then we do Balasana. So breathe in. Oh no, sorry, I forgot the massages. Put your left hand over your liver and the pancreas, and then right hand on the top. Take a deep breath, breathe out, and just massage it. Do this one more time. You breathe in and out and come up. You do the right side, left side, so right hand, and put the left hand on the top. Take a deep breath. Breathe out, come down, and look up. And come up. And you do one more time, balasana. So hand on your knee, and then you breathe in, raise your hand, go back as far as you can, and then you come down. There are lots of other benefits as well. Balasana. Help you to relax, exercising the organs and stretches your lungs as well. Then your back, your spine. Breathe in, come up again, one more time. And back, and come down. And relax, just come up slowly. We do Ujjayi, and then we do Brahmani. Ujjayi is also help you to clear your blocked arteries and also regulate the cholesterol levels and also prevent sleep apnea, snoring. So we will cough first and make a 3 short breath sounds from your neck, and the long one. Then you hold your breath, put your chin down, and then when you can't hold it for longer, you close your right nostril and breathe out from the left nostril. So we give it a cough first. Breathe out. Put your chin down, hold as far as you can, as long as you can. And close your right nostril, come up, and breathe out from the left. Do one more time. Your right nostril, come up, breathe out. Longer you do it, better. Longer you hold it because you're taking a lot of oxygen. That help you to clear your throat, all your problems that you have. Next, you will do Brahmani. Brahmani has also help you to produce loss of nitric oxide, help you with the headache, migraine. So close your ears with your thumb, and then your 3 fingers goes over your eyes, and your index fingers between your third eye, and then you close your mouth, do with the Khichdi Mudra, and then you make a bumblebee sound. You sit in again, Mudra, keeping your eyes closed. You chant Om 3 times. Keeping our eye closed, concentrating on the third eye. You do silence breathing. You meditate yourself. Relax your body completely. Rub our hands together. Over your eyes. Slowly open the eyes. We do the prayer and then we do Simhasan. Om Sarve Bhavantu Sukhina Sarve Santu Niramaha Sarve Pandrani Prashantu Mahakashi Dukha Bhave Om Shanti Shanti Shanti. May all be happy, may all be healthy, may all enjoy prosperity, may none suffer. Om. Do Simhasan, everybody. And then you can unmute yourself. You want to?
Unmute yourself. I've done that.
Right.
हम बोल सकते हैं किसका सब टंग वाइट है बीमारी का जड़ है
And then you all laugh.
Thank you very much. Tomorrow class I will take the class.
Thank you,
Thank you.
Thank you.
Excellent.
It was
Excellent.
really good
Excellent.
class. Thank you.